Here's to your health, brought to you by Coliseum Health System. Stroke is the third leading cause of death in the United States, but a fast reaction time to the warning signs can lead to a successful treatment and recovery. With more, here's Dr. Ralph Griffin.
Stroke is really best diagnosed and best treated at a stroke center because you have protocols in place, you have a team approach, you call what we call a code stroke, and it puts into action a lot of different folks doing things at the same time. So you've got your radiology folks, you've got your nursing personnel, you've got your doctors, and a whole team of people that are acting at the same time to make the diagnosis quickly and to get the treatment as fast as possible. We say that with the heart, when there's a heart attack, and that's caused by a clot also, that time is heart muscle. With a stroke, we say time is brain. So it really is important to do it immediately.
At the onset of stroke symptoms, when you reach the emergency room, several tests are performed.
We run blood tests, including blood counts. We run chemistries and coagulation studies, blood clotting studies. We run urine, we run chest x-ray, we run an electrocardiogram, and the most important test that we run, the one we try to get absolutely as fast as possible, and often we get it immediately. We take one look at you and get you to this test if possible, and that's a CT scan of your brain and head.
There are different types of strokes, and they are treated in different ways, but time is a critical factor in any treatment.
If we get a patient early enough, and they have we call it an ischemic stroke, but it's the one that I mentioned that's caused by a blood clot, then we have medication that we can administer, which has greatly or significantly improved outcome if it's given early. But it has to be given within the first 4.5 hours, and preferably the data is that the improvement is mostly within the first 3 hours after the onset of stroke symptoms.
One major factor of strokes? High blood pressure or hypertension. With more, here's Denise Goings.
The American Stroke Association recommends your blood pressure being around 120/80. Statistics have shown that patients who maintain that blood pressure of 120/80 have almost less than half the risk of someone else. Now, when you talk about 120/80, everybody thinks that has to be ideal. Of course, there are patients whose blood pressure is lower and patients whose blood pressure may run a little bit higher to average together to get that 120/80. But it's so important that patients follow up with their physician, that they take their medication like they're supposed to, and they need to know what their blood pressure is.
There are many risk factors for strokes. Some are hereditary, but there are some risk factors you can take control of.
If you think about a risk factor of high blood pressure, diabetes, being overweight, your cholesterol, just your diet and exercise can reduce all 4 of those risk factors. So you've got one thing, watching your diet, that can actually impact 4 risk factors. You know, we do have risk factors that you can't control. Of course, that's like heredity. If you have a family history of stroke, that puts you at a higher risk of having a stroke. Gender, men statistically have more strokes younger than women, but women, we live longer. Men don't like to admit it, but we do. We live longer. And unfortunately, we have more catastrophic strokes. So each year, there are about 55,000 more women having strokes as men. Twice as many women die from stroke as they do from breast cancer.
It is important to recognize the warning signs of a stroke.
Of course, everything, the key is sudden weakness in the face, the arm, the leg, and it's generally on one side of the body. Sudden confusion, sudden trouble speaking, maybe their speech is slurred, maybe they're not saying the right words. Sudden trouble with their vision, blurred vision or double vision. A sudden severe headache. If this is a headache that you've never had before, that could certainly indicate that you may be having a hemorrhagic stroke. Those are the kind of things that you need to be very cognizant of and not disregard. The person that wakes up in the morning and they're doing fine and they go to pick up their cup of coffee and they drop it, and that lasts for 10 or 15 minutes, and then they say, oh, I'll just wait till later. Those are not signs that we need to ignore.
If you suspect you or a loved one is having a stroke, the first thing to do is call 911.
Don't try to get the person in the car. Don't try to drive them to the ER, and certainly if it's yourself, don't try to get into the car and drive to the emergency room yourself. You want to call 911, let them come. They can go ahead and start doing the workup. They can do an EKG, they can draw lab work, they can do a neuro assessment. So, of course, not as extensive as in the emergency room, but they can begin that process. They can alert the emergency room, so they're on standby and they know that person's coming and they're ready for them as soon as they roll in the door.
Thank you for watching Here's to Your Health, brought to you by Coliseum Health System.